I will call Representative Bierman to the testifier stand. I will move House File 4466 come before the committee, and I believe, Representative Bierman, your motion is that this bill be referred to the General Register.
Thank you, Mr. Chair. Yes, that is my motion.
Thank you. Representative Bierman moves that House File 4466 be approved and referred to the General Register. We have an A8 amendment. Representative Bierman, would you care to explain the amendment?
The A8, Mr. Chair, is a couple of technical fixes that research discovered, and so we're just doing that now to take care of those. If we want a fuller explanation, I believe Annie Mock is here. Could do that.
Louder.
Is she not?
Okay, A8 is before us. Any questions from members regarding the A8 amendment to House File 4466? Seeing none, I move the A8 amendment. All those in favor, signify by saying aye.
Aye.
Opposed by the same sign. Mr. Representative Bierman, your bill is amended to the bill. We have
Thank
what?
you, Mr. Chair.
Oh, sorry.
and-
Hold on a second, Representative Bierman. I may have jumped ahead too quickly. We have a couple more amendments to consider. The A9 amendment, Representative Katiza Watun.
Oh, thank you, Mr. Chair. I would like to present the A9 amendment. Members, this is a very lengthy amendment. It is 141 pages. The first 120 pages are Article 4 and 5, which are about child care licensing modernization. This is a project that the department, both at DHS and DCYF, have been working on with child care providers and advocates and legislators for a number of years. Actually, we initialized a project back in 2019 when Chair Pinto was chairing the Early Childhood Education Committee subcommittee, and so this began this multi-year process to discuss with child care providers, parents, advocates, as I mentioned, on how to tighten up our licensing process. And so this includes years of work. The lead on the DFL side was Representative Nathan Coulter. The lead on the GOP side was Representative Danny Nadeau. Chair West has also been intimately involved in this process, and I believe at one point said that it was his top priority for the year. There are a number of other bills that are included. So if you skip to page 120, at the bottom of page 120, you will see an article for crisis nursery licensing. The chair, Torkelson himself, has carried this bill on behalf of a wonderful organization that is in his district. There's also a crisis nursery in Minneapolis and one in St. Paul. We are hopeful that with the direction to the department in this proposal, they will be able to create a single crisis nursery licensing package. Currently, crisis nurseries are required to be licensed as two separate facilities because they provide overnight care and they provide ongoing care in addition to emergency care. So there's a couple complications there. It's a very good bill, and look forward to having that as a part of our child care infrastructure. Article 7, members, on page 121 is a Nadeau, Representative Nadeau bill, which has to do with MFIT and SNAP benefits and drug testing. Article 8 on page 122 is a Representative Bjorn Olson bill, which allows child care providers to self-report if they have violated a conditional license or correction order, and then that's publicly posted, something that child care providers have been asking for, and I appreciate Representative Olson's work on that. Let's see, then here, page 125, this is a Representative Ben Bakeberg bill on recognizing physical abuse. There is a poster that is required to be publicly available in child care centers so that parents can recognize the symptoms and signs of abuse to help keep our children safer. Article 9 is a section on child protection and welfare, which includes bills from Representative Clardy, Representative Hicks, Representative Pinto, and Representative Liebling. They impact children in school-age care programs in foster care so that they're able to more easily be admitted to programs that they have access to, but that we're changing the priority for children in foster care simply because parents who, foster parents don't always have a lot of extra money to help support and find other after-school care programs, as well as those extended family and kinship care providers who are welcoming extended family into their home, but certainly are doing so at a fiscal and financial cost to their household. And then finally, members, on page 139 is where the appropriation section begins. So there is an appropriation for Chair Torkelson's bill to create a crisis nursery license that the department has requested, as well as funding for the Parent Support Outreach Program, which is carried by Vice Chair Hansen. This program is one of the most well-researched and well-utilized programs to support parents in need, and truly every dollar that can be invested into this program makes a huge difference in the care and keeping of our Minnesotans. And then finally, the last provision is House File 2136, which is a Representative Pete Johnson provision, which is allocating grant funding for forensic interview training scholarships. And this is something that is just so critical when we think about children who have been abused sexually or otherwise, children who have been through trauma, children who have witnessed domestic violence potentially. And this allows interviewers to be trained in this specialized interview process to make sure that they're not re-traumatizing children and to ensure that these children don't have to tell their story over and over and over again while they are helping us do our work to ensure that we keep other children safe and get to the bottom of the process that these children have been a party to due to no fault of their own. So, Mr. Chair, in short, this A9 amendment is the non-controversial bipartisan work of the Children and Families Committee this year. And I think that, there is it's a relatively small cost. Certainly, we were not given any committee budgetary targets, and I think we've done a very good job to pare down our priorities in terms of fiscal asks. And I think that this is truly our last chance to create a House position on the care and keeping of Minnesota's youngest residents. And I would ask for a green vote.
Thank you, Representative Katiza-Wattu. And would either of the authors of the underlying bill care to comment on the A9 amendment? Representative Bierman.
Yes, Mr. Chair, I look at the A9 as a friendly amendment, and I would ask for members' approval.
Chair Backer.
Yes, a lot of good information here, but this was a interesting bill to put together, and with us to continue to work with the other body, I would ask members to vote no.
Thank you. Any other member comments or questions regarding the A9 amendment? Representative Katiza-Wattu.
Thank you, Mr. Chair. I did just want to point out that I have shared information through this process with the chair, with my co-chair, with co-chairs Becker and Bierman as well, to make sure that everybody was in the loop on how this has moved through the process. And it is news to me that the recommendation from the Republican side is a no vote to this amendment. So I'm disappointed to hear that. I think that we we've done really great work in children and families this year because of the committee structure in the other body. There is not a Children and Families Committee over there. Our work gets bundled with the work of the Human Services and the Health Committee on an annual basis. And I don't see how this amendment doesn't have its place within the package that we are going to hopefully vote out and support and send to the other body eventually for a conference. So again, I would ask members to consider supporting, and I would request a roll call.
Roll call requested, roll call granted. Representative West.
Thank you, Mr. Chair. Many of these provisions within this amendment currently sit in this committee, and I would very much like to see them advanced. So if we do in a future hearing, we should move those bills forward. As well as some of the provisions are also on the floor. And the Senate is carrying many of these, and it can be a discussion in conference committee, but I will not be supporting the amendment.
Thank you, Representative West. Representative Frazier.
Thank you, Mr. Chair. Thank you, Chair Carter-Tizoutun, for bringing this, and I appreciate the bipartisan manner in which you did it. Looking at the package, I think it seems to be pretty fairly done in terms of spreading the love around for members and the bills that they have in here. I do think it's important, as always, when we go into these conversations with our Senate colleagues, that we have a very strong position. And anytime we are discussing areas involving our young people and the ways that we need to protect them and provide resources, I think we should, as Republicans and as Democrats, we should be in one and have a unified, clarifying message. And I believe this amendment actually does that. So thank you for bringing it. Members, I would request a yes vote.
Well, thank you, Chair Frazier, and thank you for bringing the amendment forward, Representative Tizoutun, Chair Tizoutun, but I'm also going to recommend a no vote at this time, although I certainly have some friendly thoughts about portions of this amendment. It greatly expands the bill before us. Roll call being requested. We'll take the vote.
Chair Torkelson.
No.
Chair Frazier.
Yes.
Vice Chair Scott.
No.
Vice Chair Agbagje. Representative Acom.
Aye.
Representative Backer.
No.
Representative Baker.
No.
Representative Bierman.
Aye.
Representative Gomez. Representative Heintzman.
No.
Representative Igo.
I go no.
Representative Cleaborn.
Cleaborn, aye.
Representative Cagle.
Aye.
Representative Katiza-Watun.
Aye.
Representative Koznick.
No.
Representative Kresha.
Kresha, no.
Representative Lilly.
Lily, aye.
Representative Moeller.
Aye.
Representative Nash.
No.
Representative Noor.
No, aye.
Representative Novotny.
No.
Representative Olson.
No.
Representative Pinto.
Aye.
Representative Schumacher.
Schumacher, no.
Representative Swedzinski.
Swazinski, no. Swazinski, no.
Representative Vang.
Aye.
Representative West.
No.
Representative Joachim.
Yes.
Representative Vice Chair Agbagje. Representative Gomez.
With 12 ayes and 14 noes, the amendment is not adopted. Amendment is not adopted. We'll move on to the A11 amendment of Representative Scott.
Thank you, Mr. Chair, and I would move the A11.
Thank you. The A11 amendment is before us. Representative Scott, your amendment.
Thank you, Mr. Chair. There's a new section that's being proposed in Article 2, starting on page 15 that has to do with the all-payer claims database. And I want to draw members' attention particularly to page 17, where it's talking about the fees. And the process around here, when we're talking about data and data sets, is that something like this should come to the Judiciary and Civil Law Committee, because that's where we deal with these issues. This new section never came to our committee, and so I hope that the chair will indulge me while I ask a few questions, since this wasn't brought before our committee, and I do have several questions that I would like to have answered. And I don't know if the bill's authors can answer these, or if there's someone here from the Department of Health that can help answer these questions.
Mr. Chair.
Yes, I have the, yes, I have the.
Mr. Chair,
Representative Bierman.
the department is here, and I think I'll just ask them to come up, and while they are coming up, we can start.
All right, sounds good.
I just did want to mention the APCD is an essential piece of a new policy for us in the health field, and really have helped a lot with opioid addiction, rare disease, and healthcare spending drivers. And next up is prior authorization, so we can have better insight. But we have Director Gildemeister is here to answer detailed questions.
To your question, Representative Scott.
Thank you. It's questions, Mr. Chair. Questions, plural. Okay, so if de-identified data or limited use data sets are re-identified by someone who purchases this data, how would we know?
Please identify yourself for the record and go ahead with your answer.
Mr. Chair, for the record, my name is Stefan Gildemeister. I direct the Health Economics Program in the Minnesota Department of Health, and it's our team that maintains the APCD, provides oversight, and analyzes the data as well. To your question, Vice Chair Scott, the data is de-identified. It comes in a de-identified form to MDH, so it lacks information such as name, address, birth date. There are no images on there for individuals whose data are there. We don't know who's in the data. As the data, the process for data sharing involves a couple of steps that ensures that re-identification does not happen. So number one, I think re-identification is really difficult because the data is de-identified. Number two, we're working with we will establish an advisory group that will carefully vet applications to use the data for public uses. Number three, the data sets will be designed with minimally necessary data elements to limit exactly what you're describing. And then number four, researchers will use the data systems over which the state has oversight, and we monitor use of the data. Finally, none of the data can be taken off the system without MDH review.
Chair Scott.
Thank you, Mr. Chair. I'm not sure I heard an answer in there that if someone is de-identifying the data, then what happens? And is there any penalty in law or in these contracts that you sign with these folks? Is there any penalty for de-identifying that data and then maybe selling it on again? I mean, we're selling it here. We're selling personal claims data, health data to people, even though you say it's de-identified, it does include their birth date, their zip code, and their town. That's federal law, 45 CFR 164.51. So help me understand how that would work if it's re-identified and sold. Would there be a way for the Department of Health to know?
To the question.
Mr. Chair, Vice Chair Scott, I neglected to clarify that, yes, we would have a contractually enforceable data use agreement, and that binds people to complying with the Minnesota Data Practices Act. And there are there is enforcement built into it in violating contracts and making available data. It is our intent to ensure, to monitor the use of the data through tools where we track how people use the data, but also to prevent additional data coming onto the system. So, but yes, in direct answer to your question, I'm sorry that I didn't catch that at first, there is an enforcement authority tied to Chapter 13.
Chair Scott.
Thank you, Mr. Chair. And is there any restriction on who this data can be sold to? Could it be sold to someone outside of the United States?
To the question.
Mr. Chair, Vice Chair Scott, the provision, maybe a small correction. We don't think of these data as being sold. We think of these data as being made available for specific targeted, time-limited research projects, at the end of which these data must be destroyed. And it's our job to ensure that that happens. Remember also that these data are not coming off the system. So selling them, taking them, selling them to somebody else, giving them away, putting them on your home computer, there are administrative software, physical tools to prevent that. As to permitting entities, researchers outside of Minnesota to use the data, I think it would be hard to imagine that their proposal would fit the requirement that these data are used in the public interest for Minnesotans. But again, to reiterate, the language that passed in 2023 requires the health department to ensure these data are only used for a public interest of Minnesotans.
Representative Scott.
Thank you. So I didn't hear a definitive no that they couldn't be. It's just that you couldn't imagine that they would be. But as we know in this world, he who owns the data is king, right? So that gives me some concern. Would an entity that's required to submit data to this database be required to purchase a copy of the data under this new law? So if we have an Alina clinic that's supplying all this data, would they then have to pay to get access to their own data?
Mr. Gildemeister.
Mr. Chair, Vice Chair Scott, it really depends on the aim of the proposal. So it's entirely feasible, for example, that self-insured employers who contribute data to the APCD and wish to benchmark the prices that they face or to support the fiduciary duty that they have vis-a-vis their employees, that they get a fee waiver. So the language, again, from 2023 has built in a fee waiver, which the commissioner may grant.
Representative Scott.
Thank you, Mr. Chair. So this bill's definition of a limited use data set acknowledges that it may include protected health information from which certain direct identifiers of individuals have been removed. This means some protected health information, or PHI, and identifiers will remain in the data being sold. Is there a list of all the types of PHI and identifiers that may be included in these limited data sets?
Mr. Gildemeister.
Mr. Chair, Vice Chair Scott, if it's okay with the committee, I would like to provide this after I phone a friend. And I wanted to correct Vice Chair Scott, the data does not contain people's birth date. So what information is contained in the data is a person's sex, the 5-digit zip code at which they reside, and then included in these data are information on the procedures that were provided, the price for those, the diagnosis under which these services were delivered.
Mr. Gildemeister, you can start dialing if you would like. To phone your friend, that is.
My text.
Chair Scott.
So I'm confused because you said that there's no PHI, but on 17.21, it says limited use data set means a data set that meets the requirements of Code of Federal Regulations, Title 45, which I just alluded to, and may include protected health information from which certain direct identifiers of individuals have been removed under the principle of minimum necessary information. That reads as if there's some personal identifying information that still may be part of those data sets. So while you phone the friend, I'll go on with kind of my last question here, Mr. Chair. Why the price difference between these different kinds of data sets?
Mr. Gildemeister.
Mr. Chair, Vice Chair Scott, the price difference really has to do with the effort the health department must put into designing and maintaining these data sets. So the lowest price data is a fixed format data set that would require relatively little effort to maintain. The customized data set that would be targeted to certain clinical or policy questions just require more effort up front to design these data sets so that they are targeted to the questions that the researcher requests to use these data for. And of course, the process involves making sure that the data elements available to individuals are the minimally necessary data elements.
Chair Scott.
Thank you, Mr. Chair. Well, minimally necessary may vary depending on what the researcher is applying for, right? So I'll just restate that I have concerns that this never came to the Judiciary Committee for full vetting. I have even greater concerns about the underlying language that greatly expanded this program in 2023. I know that this is a delicate bill right now, so I'm going to withdraw my amendment, but I would just ask for in the future that anything to do with this all-payer claims database and the use of people's health data come to the Judiciary Committee for a full vetting. Thank you, Mr. Chair. I'll withdraw the A11, I think it is.
That's correct. Chair Scott withdraws the A11 amendment. We have completed the list of amendments to the bill. Chair Bierman.
Thank you, Mr. Chair. I will begin, and I believe my co-chair would like to say a few words when I'm completed. Maybe he can end on a higher note than I will. House File 4466 is the Health Finance and Policy Bill. And I will tell you, I am neither pleased nor enthused to be one of its chief authors in its current state. The bill is less than modest in its proposals and does not address key healthcare needs in this state that our people need and deserve. The bill is primarily, simply, an alignment with the Trump and Republican Medicaid cuts, changes, and restrictions of H.R. 1, which will set healthcare in this state and our country back for a decade, if allowed to stand for that long. To be clear, H.R. 1 is injurious, wasteful, and misguided policy. While it is bad, even disastrous, it is also here. And we as a state must align or face even more harmful consequences from this federal government. Today, I will not be telling people how to vote. I will be a yes, because this bill must get better for me to vote for it after conference committee. To the bill as H.R. 1 provisions, this bill includes a 45-day look-back period for work requirements, a 1-month retroactive eligibility look-back for the expansion population, 2 months for everyone else. It conforms to both 2028 provisions on cost sharing and home equity. And then beyond the H.R. 1 alignment, we have a very few member bills. There's a Rep. Ryer physical therapist scope bill that changes on-site supervision. There's the forecast bill, of course. There is 3 Representative Hewitt bills on reciprocal license, internships as they learn, supervisor oversight and alternates to be permitted for mortuary science, and also some changes to the natural organic reduction bill. Co-Chair Backer has an insulin bill, and Representative Schultz has a bill for private pool owners to be able to utilize their home pools for swimming education. That's all that's in the bill. It is the shortest health bill I've seen in 8 years up here, and really look forward to doing more work with the co-chair and with all of you moving this bill forward. It really does need to be worked on, and I want to again emphasize the impacts of HR 1, which are things that we need to do, unfortunately, through alignment, or risk some pretty harsh retribution. So the bill, including HR 1, will increase costs for the state, for all the counties, drive increased uncompensated care at our hospitals, and cause higher healthcare premiums for each and every one of us. HR 1 will lower taxes for the ultra-rich and help increase the national debt to over $38 trillion if you are into that sort of thing. So I believe that specifically, this bill can be improved if we put in some policies to address the pressing needs of mental health treatment, substance use disorder, and direct more focus on the critical shortage of direct care professionals and specialized in-home support professionals, which are especially needed in greater Minnesota. These additions, at a minimum, would make this bill more worthy of passage and something I could support. Thank you, Mr. Chair.
Chair Backer to the bill.
Yeah, thank you. And it has been a pleasure, continues to be a pleasure to work with Co-Chair Bierman. You know, us Minnesotans, we are independent. So whenever the federal government puts something on us, which I would refer to as the parent, and they make up 90% of a lot of our payout, we are required to follow in line, or members, we would lose $3.5 to $4 billion a year. So I don't think none of us likes that. I'm not saying that I'm head over heels with HR 1 conformity. At the same time, I am very concerned if we do not work within the parameters set by the federal government, like we've seen years past with the Affordable Care Act and other bills that have came down. We were encouraged, pushed, whatever word you want to say, to conform with that. So this is a lean bill. It is focusing on what matters, and that's healthcare and conforming with the federal government. And we've had a lot of discussions. We'll continue to have discussions because I think it's very important for the House. And I appreciate also Co-Chair Bierman appreciates we get into the conference committee and the House has a position. Because folks, if we do not conform, we're talking about huge amount of money that's lost. And there's not many dials that we could have dialed. And a lot of the dials we agreed to with the governor on this, not 100%, but the governor's office and the position in this bill is where a lot of kind of started from with Representative Nadeau, and I was the co-author on the bills. So I would ask for a yes vote. It is good work. It is lean. It is straightforward. And thank you, members.
Thank you, Chair Backer. I will turn to fiscal staff, Ms. Adrians, for explanation of the fiscal impacts of this bill.
Mr. Chair and members, you have in your packets a spreadsheet, and if you would like a thorough walkthrough of the spreadsheet, our expert, Ms. Stern, is here and would be happy to do so, but I can mention that the overall impact of this bill is in the first biennium for fiscal years 26 and 27. There is a savings that's generated of just over $2 million. And then in the 2028 and 2029 biennium, there is a savings to the general fund of almost $98 million.
Thank you for that. With that, we will turn to member questions. Representative Moeller has a question.
Thank you, Mr. Chair. And my questions are in relation to page 50 to 51. The citizenship requirements, and the way I understand how this works is under current law before HR 1, eligible for medical assistance, eligibility included citizens and then qualified non-citizens. And so those non-citizens included things like people who were granted asylum, people who are determined to be battered non-citizens, victims of trafficking. And so my understanding is that under HR 1, and then what we're doing with this bill is we're removing Medicaid coverage for those people. And I'm wondering if someone can answer that question.
Chair Bierman.
Thank you, Mr. Chair, and Representative Moeller, you are exactly correct. There have been wide swaths of people who have been previously covered with Medicaid who will no longer receive coverage.
Chair Moeller.
Thank you, Mr. Chair. And that is extremely disappointing. We're talking about victims of torture. We're talking about victims of gender-based violence, domestic assault. We are talking about victims of human trafficking that are going to get denied this coverage. I don't think we can pretend for 1 second that this federal administration cares about victims of crime. So if they say they do, don't let them. I also reject the notion that we're required to fall in line, as the co-author said here. I understand the need to do this for financial reasons right now, but all of us have a voice and could have, and some of us did, push back on HR 1 when it was being proposed in Congress. Last year, many of us said, we are really worried about the things coming down from the federal administration and what that means to Minnesotans. And we sort of were met with, well, don't look up, it hasn't happened yet. It has happened now, it's horrible, and it's up to each and every one of us to continue speaking out about it and to not, quote, fall in line. Thank you, Mr. Chair.
Other member questions? Co-Chair Frazier.
No other members?
That's it. You're it.
Thank you, Mr. Chair.
I'm sorry, I didn't have anyone else on the list. Chair Noor.
Thank you, Mr. Chair. Thank you to Chair Bierman and Chair Baca for bringing the federal alignment for the HR 1. But what I'm seeing here is we've added additional stuff that should not be added in this bill. You know, making sure that we are aligned in a good faith effort by using the guidance that we've been given and also the limits that we're putting in. I can start from Article 3, Section 1, which is the beginning of that conformity. If you look at line 3.8 to 36.8 to 36.11, that is a significant change. I was hoping Chair Scott will have caught up with that because that's a significant violation of Minnesota Statute 13.46 of the welfare data because you are taking everything within the Department of Employment and Economic Security and using it without the consent of the individual, which is a significant expansion, which is also against the federal rules under 42 CFR 431 and 435. I can go on, but that's a red flag to me that we're able to take the private data and take it as a whole, which is under Minnesota Statute Chapter 116L. How did we get there? And how did the judiciary allow us to allow the changes to completely take the entire chapter of data about individuals' employment and give it to the commissioner without putting some limits? and even ignoring 13.46, which is the welfare data, which the agency is already authorized.
Mr. Chair,
Chair Bierman.
that's a good question, Chair Noor, which I think we need to flag that and look at this as we go into conference and have some more discussion about that. I'm not sure directly at this moment if that is part of the requirement of HR1. I suspect that it does have something to do with that alignment and the granting of certain data points across many aspects of people's lives and using it to determine eligibility going forward in this bill.
I'd like to also comment, if I may, Chair.
Chair Becker.
You know, I'm fairly sure, and again, like Co-Chair Bierman talked about, we'll look into it further, but agencies are allowed to exchange a limit subset of data for allowing them so they can administer federal benefit programs. So that's what I understand.
A follow-up, Chair Noor.
Thank you, Mr. Chair. That is not the norm. I think if you look at Chapter 13.46, clearly the welfare data is defined and what is allowable under that section. So I think we need to be looking at that. And also, I'm looking at the 45 days rather than the 1 month look back. I don't know how we came up with 45 days. The option in the guidance said 2 months or 1 month. Now we are having a different number, which is completely different than what the guidance states. How did we get there to a number that is not even in the options, in the guidance that we are given by CMS?
Chair Becker.
You want me to comment?
Chair Bierman.
Mr. Chair, excellent question, Chair Noor, and that is just a number that we had strenuous disagreements about this issue, and we went back and forth, and we put that on as a placeholder to get it in line in ways. And the determination of whether that will stand, it really, we're looking into CMS, whether they will permit it. It's going to create more work for counties to do that and for DHS. And I'm not certain that it can be done other than you can start out with a 40-day, but I have also read and heard that after 45 days, you need to get on the normal schedule of monthly dates. But it was a sticking point. And the governor is 30, and I hope we'll get there too, because it would be more work for the departments to work with that.
Chair Becker.
Yeah, it gave a range in the bill. There was nothing in that came from the federal government that limited to 45 or 44 or 60 days there, Chair Noor. Good question. And the department needs to set up a system. Saying that they haven't done it in the past is no different, in my opinion, saying an infant hasn't walked, so they can't walk. So it is something that we will be having the conversation on, but the chief author of the bill, and I would agree with the chief author, which is Representative Nadeau, it did not say you couldn't do it that, and it was a placeholder. So we could keep this moving forward.
Other
final
member
question, Mr. Chair.
questions? Representative Noor, another follow-up?
Thank you, Mr. Chair. Going through the lines, I can go line by line. I think the question that we have is this bill is more prescriptive. We're giving guidance in almost everything without giving room for the agency to reflect what they, in alignment with the federal requirement. Even looking at the requirement that we have to look at the SNAP program employment as part of the process, which is line 46.9. It looks into the SNAP employment program, but we're ignoring even the MFIP, employment, which should also be qualified under that section. So if we're going to be more prescriptive on which sections that we're going to be pulling on, it's going to be very difficult for the agency to administer. Looking also into the technology needs for us to be able to be in compliance. We haven't put a lot of resources for the counties. We haven't put resources for even the state to also start addressing the challenges with HR1. So I think this is This needs more work, and I'm hoping that we can collectively come together to make sure that we have got a bill that is ready so that we don't get sanctioned by the federal government.
Any other comments from the co-chairs?
I would just say one thing, and I agree with Representative Noor. The counties and the state, when it comes to tech, is way behind. It's no different than at the end of a semester in college. Sometimes you're pushed to get the work done, and this may be the thing that pushes for the state to update the stuff that they need. I think we have agreed that there are things that the state needs for tools, and this may be the thing that pushes us over the edge. So, good point. Thank you.
Chair Bierman?
Just a comment that I'd like to find another state that has picked out 45 days or this odd number. What's provided is in the guidance is months, not days. So we'll try to fix this. Thank you, Mr. Chair.
Co-Chair Frazier.
Thank you, Mr. Chair. Thank you, Rep. Bierman. Thank you, Rep. Backer, for working on this together. Rep. Bierman, thank you for your frank and explicit and open and honest comments about what this will do, what this bill will do with aligning us with H.R. 1. I want to bring it back to these are people that will be harmed by this. We are currently in the midst of a conversation to save our level 1 trauma center safety net hospital because of the financial strains that they have. This will create more uncompensated care, which means that it will create a bigger burden on that hospital, but more so, it will create a larger burden on some of our smaller hospitals around the state. We have lost some of those hospitals already, and now we're being asked and forced to have a larger burden on more of those hospitals. This alignment with H.R. 1 is we're being forced to, and I would say in many ways as hostages, we're being forced to do the dirty work of the federal administration here. And I say that as a matter of fact. That's what we're being forced to do here. And I believe it should be in our best interest to do everything that we can to lessen the harm that is going to be done here. I know I will not be voting for this bill, and Mr. Chair, I'll ask for a roll call. I will not be voting for this bill. I know it will move on, but I am hoping that we can do more in terms of harm reduction as the conversation continues on. But we are being held hostage, and we are being forced to do the dirty work of administration that does not seem to care about the harm that this will do to many individuals, not only in this state, but around this country. We have one of the best medical systems in the state, in the country right now. We're being forced to be less than that. We will be forced to be less than that if we accept all of these alignments here. And I have deep concerns about that. And I know the rest of the state does, and my committee members do as well. And I believe all of the committee members here have deep concerns about that because we will all be impacted by this.
I will renew the motion that House File 4466 as amended be referred to the General Register. Roll call has been requested. CLA will take the roll.
Chair Torkelson.
Yes.
Chair Frazier.
No.
Vice Chair Scott.
Yes.
Vice Chair Agbedje.
No.
Representative Acom.
No.
Representative Backer.
Yes.
Representative Baker.
Aye.
Representative Bierman.
Yes.
Representative Gomez.
No.
Representative Heintzman.
Yes.
Representative Igo.
Go aye.
Representative Cleaborn.
Cleaborn, no.
Representative Cagle.
No.
Representative Katiza Watoon.
No.
Representative Koznick.
Yes.
Representative Kresha.
Kresha, yes.
Representative Lilly.
Lily, no.
Representative Moeller.
No.
Representative Nash.
Yes.
Representative Noor.
No.
Representative Novotny.
Yes.
Representative Olson.
Yes.
Representative Pinto.
No.
Representative Schumacher.
Schumacher, aye.
Representative Swedzinski.
Swazinski, aye. Swazinski, aye.
Representative Vang.
No.
Representative West.
Aye.
Representative Joachim.
No.
There being 15 ayes and 13 nays, House File 4466 as amended is passed and to be referred to the General Register.